I'm John Schrott, and this is On the Spot with IKM. This morning, we have the privilege of talking to one of our associates and a project architect in the firm, Jason Hindes. And Jason is an in-house expert as it relates to behavioral health. You know, something that's on the topic of a lot of people's conversation these days in the US. So I know that there's some complications when you design for behavioral health. What are some of the main points you have to look for when you're doing a behavioral health facility?
Well, really, all behavioral health facilities have two main overlays of philosophy, and it's all geared towards patient safety and staff safety. And there's any number of layers that build into both of those things. You know, starting with the finishes that you use, making sure that they can't be picked off, broken, used in an inappropriate manner. Same with all of our wall-mounted accessories, door hardware, making sure it's anti-ligature, making sure everything is slope tops. And
So anti-ligature means it can't be extracted or used.
correct. A ligature point is a point of looping over
Okay.
top of. So anti-ligature door hardware, wall-mounted accessories, they all slope tops to minimize that looping, which is really just a point for a patient to create potential harm for themselves or others. And also in behavioral health facilities, staff is equally important. They have a hard job that none of us I know could really deal with and manage. So how do we make their lives easier? How do we make their lives safer so that they're able to provide the best care for patients? And that's any number of ways, from how a space is laid out, providing areas of refuge for them, providing safe manner of visibility through laminated safety glass, make sure they're able to see patients, able to monitor, make sure the patients are safe, but also keep themselves safe as well.
So being able to see patients, does that mean you need to position where the staff works in a special location as it relates to where the patients are?
Yeah, absolutely. Really, the patient realm, a lot of their social spaces that they have in these facilities really needs to be under full visual control from a nurse station or from the perspective of staff. So a lot of what that means is eliminating corners, making sure that there's straight lines of sight, and really making sure there's no corners to hide behind, but then also in a patient's psyche, not knowing what's around the next corner, might be something that's anxiety inducing to them. So really making sure that the space is designed for full visibility, because ultimately visibility equals safety.
So how do you create a space for the patient that makes them feel more comfortable and feel more calm and doesn't provide any triggers?
Natural light.
Natural light.
Natural light. I mean, in any healthcare facility, natural light is ultimately one of the biggest positives that you could inject into a facility. And the history of behavioral health, these facilities are designed as bunkers, and so as best we can moving forward, open up those buildings, allow natural light, allow interior courtyards where patients can experience the outdoors, potentially at their own free will without having to be taken elsewhere to get their required outdoor recreational time. And then just brighten up the space. Treat the space as you would any other healthcare environment. It's just the finishes will be a little bit different. The finishes will be a little bit safer, but you don't have to have that bunker mentality. You can really create nice environments for these patients that will really benefit them in a safe manner, as long as you're using the right finishes and right design techniques.
Well, thanks, Jason. Thanks for being on the spot. And until next time.